Hi there, my name is Catherine Ferguson.
I'm Marilyn Morrison. We're both program advisors in continuing education in the Faculty of Health Sciences and Wellness. Today we're going to talk to you about clinical placements. Catherine, which placements do you oversee?
I oversee the emergency nursing clinical placements.
And I've got nephrology placements, RPN and RN, and obstetrics and breastfeeding placements under my portfolio. We have two other advisors who are looking after cardiology,
Critical care,
high acuity nursing. One of the questions students often ask is, how do I know I can be successful in this course? I'd like to drive you right back to the course outline for the very beginning. A typical course outline will be sent to you from Nita, and you'll meet Nita in another video. On page 2 are your learning outcomes. To be successful in the course, you must be able to, and all the numbers of statements are listed below. So that's the first thing you want to look at is the learning outcomes. Catherine, what else?
So what we ask you to do is, if you look at, for instance, number 2, demonstrate specific accurate assessments of patients receiving hemodialysis and or peritoneal dialysis, the expectation is that you already have the theoretical knowledge, and now you're going to apply that to real life patient situations. So how do you demonstrate this? You can demonstrate this by, after you've done an assessment, coming out and having a discussion with your preceptor. You can demonstrate this by doing an assessment, coming out and accurately documenting it. The goal is that you're able to do this and identify issues from that assessment. If you look at number 2, it's number 3, demonstrating knowledge of anatomy, physiology, pathophysiology, pharmacology, teaching and counseling. So how are you going to demonstrate this in clinical is by actually coming out and having a discussion with your preceptor, doing some teaching and counseling with patients that are receiving dialysis, and either having your preceptor stand in and watch you, or documenting it after. So you're responsible for achieving every single one of these learning outcomes in the clinical, and these are the things you're going to be evaluated on by your preceptor when you're in a clinical setting.
Great. Another one, for an example, is research diagnostic tests related to renal nursing. Well, you've taken your theoretical courses over the past couple of semesters, or maybe even a couple of years. When you get to the clinical setting, you're going to learn a lot more. So whether it's emerge or obstetrics or nephrology units, inpatient, outpatient, you're going to realize, oh, there's some tests here that I didn't even learn about yet, or I need to look at further. So you can do that. It's not a big issue to be able to research diagnostic tests. So why this is important, these learning outcomes, is that when you go down to this chart, it says evaluation activity. The first thing it says for you to do is submit a schedule to the college with your preceptors, which you're going to work with your preceptor. The second thing is write your goals or learning plan. So this should be submitted a week prior to placement at minimum. The reason is the advisor needs to review that to make sure that you understand and you've picked realistic goals and how to achieve those. So the learning goals, you need to pick a minimum of 3 back to your learning outcomes. And then for each of those goals, you write up the format in a chart using the SMART format. Nita Parmar will have already emailed you sample goals. Now they will not be for the same setting you're going to be in. We do that strategically. But be specific, measurable, attainable, relevant, and time limited. You're going to use that format. Okay. Another thing to consider is your competencies. So if you look down here further, there are student clinical competency checklists, and then further there's duplicated preceptor clinical competency lists. So if you've got some idea of what you want to do in clinical and it's not reflected either on your learning outcomes nor in your checklists, then that's not going to be something that's going to fit for the course. For instance, if you think maybe I should be able to do an arterial stab in emerge to take arterial gases, or I might cannulate a patient in the nephrology clinic, those aren't things that hospitals allow us to do in the student setting. Those require extra testing, extra skills. Anything else else you could speak to about the checklist?
The one thing I would say about the checklist is to try and seek out as many opportunities as possible to get exposure. If there are things that there's a not applicable or no opportunity, which is perfectly fine, you're not going to necessarily see everything all at once. What I would do is make sure that you've actually documented that I haven't had an opportunity or I have not seen this. That way, when your preceptor looks, she'll be able to keep track of that as well. The whole idea of the checklist is so you are aware of the standards, because these checklists are developed from the standards of practice for individuals. So there's emergency nursing standards, there's obstetrical standards. So trying to get as much exposure as possible will really help you in the event you are able to attain employment or you're actually in employment now. So it's better to try and get those opportunities. The one thing I would say about the learning plan is make sure that your learning goals are not your personal learning goals so much as they are from the learning outcomes. You can choose the learning outcomes that fit with your own personal learning goals, but they need to come from the learning outcomes. There's also a hours checklist, and that needs to be signed each and every shift. It can't be signed at the very end. Each and every shift will have to be signed. We will be adding up and checking those hours. There's also a daily log, which you have been sent an example of from NITA as well. That needs to be submitted every single shift. After you're finished, you're required to fill out the log and send it in to both NITA and the program advisor attached to the course.